for joining today's session. We're really excited to be presenting. It's our first time at a Teach to Reach as the Curve. So today I'm joined by my colleagues, Dr. Rachel McCloud and Dr. Mohammed Liman, and we're going to be talking you through an introduction to responsive feedback. So just briefly, today's session will cover what is responsive feedback, because it might be a term that, that you may not have heard, who we are as the Curve Consortium. And then Dr. Rachel McCloud will be leading us through the Curve process for responsive feedback, and we'll have an example to go alongside it. And then we'll cover off, I guess, what responsive feedback and how it can help you. So what are the challenges that it might be able to help overcome in your programs? And then, as Zah mentioned, towards the end, if we have time, we'll do some Q&A. Wonderful. So just briefly, before we dive right into the session, the premise of responsive feedback is really founded on the belief that if we keep learning, we can keep improving. And now I've tried to arrange a video to come up on the next slide. So if it doesn't work, I might have to share a different screen, but hopefully.
Here's a simple truth.
Please let me know if anyone's having trouble hearing.
Keep moving forward, only faster. You see, ongoing learning is a shortcut. Examine how you think your programs work right from the start. Where are the blind spots and assumptions? Then seek feedback that can shed light on these. Don't wait for problems. Ask questions. Act on answers. They say hindsight is a wonderful thing, but foresight is a million times better. Data can reveal what we can do better, not just how we've done. So keep asking questions. Keep listening to answers. Keep testing new ideas, not just at the beginning, but throughout. We call this responsive feedback. How can you get started? We are here to make it easy, with step-by-step guides and advice to help you put theory into practice. So if you want to get better faster, the place to learn is here.
Wonderful. So that was just a really quick introduction to the concept of responsive feedback. I'll make sure to send through links around. So if you'd like to watch it again, or it's also available on our website. But hopefully that's given you a little bit brief introduction to responsive feedback. And now I'll pass over to Dr. Rachel McCloud to take us through it in a bit more depth.
Hi, thank you, Lydia. So as Lydia mentioned, now we'll just talk a little bit about what responsive feedback is and go through a little bit of the key characteristics and benefits of this approach. So if you'll go to the next slide. So what we found in a traditional approach of programs is often that the kind of assumptions or program activities will get set at the beginning of the program. You'll put things together, you'll kind of map out your plan for the course of the intervention or program. And then when you start to implement the program, you might put your activities into place that you've previously assumed are going to work. And maybe you collect some process data and some measures throughout. Maybe you monitor it some, but within the course of the study, your main goal is to implement that program as you had planned it. So unfortunately, what we find is that sometimes when you get to the end and start really analyzing the data, looking at your baseline against your outcomes, you're seeing that there's not as much success as you intended. And perhaps you even look back at some of your process notes and you can start to piece together maybe why some things weren't as effective as you had imagined that they would be. So this is one of those common problems, or even if you're gathering this data, you don't have that time to look at it and to respond to any challenges that might arise during the program. Next slide. And so the potential for responsive feedback is it's really this philosophy that integrates continuous monitoring and improvement from the beginning and all the way through. And what the hope is that through this kind of process where you can observe and test and tweak and really make sure to prioritize that learning that you're getting along the way, that you'll be in a better place to be more agile as your program is in the field, even from the very first stages through the end, and that you can catch some of these potential issues and challenges and address them before the end of that program. So the hope is that through this responsive feedback approach, you'll have those tools and that kind of mindset to be making sure that those activities that you implemented in the beginning are going to be as successful as you think. And if there are challenges that maybe arise that you weren't accounting for, you're able to be agile in the field and really to adapt those things. And so this is where responsive feedback can really kind of build upon that traditional approach to emphasize the importance and value of making sure that you're monitoring things along the way. Next slide. And so what we found is that we've really built upon some strengths that we found in many other disciplines. And this is more of an integrated framework that can incorporate elements of this feedback and learning and continuous engagement to give that benefit. And so it really emphasizes this integratedness of different stakeholders, different methods, and you'll really see as we get into the curve process how these different elements shine through. Next slide. Another key component of responsive feedback is that many people say, well, how is this different than implementation science or M&E or a lot of these different fields that we see? And our response is that we really feel like we're building on a lot of the strengths and principles that we see in other disciplines. And we've taken a lot of this from these models and really combined this to be an integrative framework. And we feel that one of the main values that we can give through responsive feedback, and you'll see this as we go along through our presentation, is this real deep analysis of the assumptions that we bring to the table and making sure that we're challenging those assumptions and making sure that they're really going to work for our programs in the field. And along this line too, we also emphasize systematic data collection to really help us structure our thoughts and arguments as we move forward. So we draw a lot from other disciplines, but we really mesh it together in this integrated framework that you'll see when we get to our curve process. Okay, next slide. And again, we have 5 key elements that are present throughout our responsive feedback process. First, and very importantly, we require diverse stakeholders to work together. So that doesn't just mean donors or the heads of organizations, but we consider a whole range of stakeholders. And we'll show you the value of that as we kind of go through this presentation and all the benefits and great input that all of these stakeholders can bring to the program. Second, and I touched on this earlier, is it's really important to interrogate and really examine either a program's theory of change, if you have a formal theory of change, but those underlying assumptions are the key here. Those activities and how you think the activities in your program are really going to work and lead to those outcomes. And I think this is one of the main benefits of responsive feedback, is it gets you to be in that mindset and be open to this kind of thing. Next is this can really help to focus where you think a program will benefit. Where can you focus your learning? Where, looking at your resources within your program, where can you kind of get that feedback that will be useful while you're in the field? And this involves a little bit of looking inward too, of making sure you have those resources available, which again, we've talked through in our curve process. And it also helps you to really structure that evidence gathering as well, to make sure you're gathering evidence in a systematic way that tells a story that can bring your stakeholders on board as you think about how to adapt your program. And then finally, bringing it all together in pause and reflect sessions, which again emphasizes the importance of coming together and thinking through the findings and the programs that you have, the evidence that you have, and making sure that when you change a program, you're doing it in a way that's going to make your program better while it's in the field. And so hopefully throughout the course of this presentation, some of these benefits will become clear to you, that when we make our explicit our assumptions and really understand how we can work with our data and get more value out of it, that we'll be able to be more agile when we're in the field, when we're on the ground, and see some problems before they start, or course correct before you get to the end of that program and then have results that don't match your expectations. Because we really want to make sure we give people the tools to work together to make decisions with confidence and help programs get better faster while they're in the field. And so now I'll turn it back over to Lydia so she can introduce the curve, our curve team. Thanks, Lydia.
Wonderful, thank you. So yeah, just to give some background on the curve, we are a consortium made up of 3 organizations. So Dr. Rachel McCloud and Professor Vish Viswanath joins us today from the Harvard School of Public Health. I'm representing M&C Saatchi World Services, and we've also got Dr. Mohammed Liman, who hopefully, I think he was having trouble joining, so hopefully he is on the call, who will be speaking today as well. More importantly, really, we are made up of a global and Nigerian community of practice. So we have representatives from funders, from governments, from research organizations, and largely from practitioners. So we've worked closely with them for, gosh, the last 5 years, building up our practice-based evidence and really testing and learning about responsive feedback. Our mission as the Curve is to make continuous improvement through responsive feedback more easily achievable for everyone. So we've done this over the past 5 years through convening practitioners to share and develop best practice, collaborating on ways to identify and overcome barriers, which we'll touch on, and showing how to harness natural opportunities for responsive feedback. We also have offered technical assistance and training over the years to enhance skill development for practitioners, funders, governments, and yeah, our wider community. So yeah, please do connect with us. We have a LinkedIn page where we update on all of the activities that we are doing, you know, over the next year or so. We also have a website, thecurve.org, and we have an email address where you can get directly in touch with us, which is there. As I mentioned, we've been collaborating with the Geneva Learning Foundation over the past 6 months to develop a self-service e-learning course and modules on responsive feedback. And really excitingly, I can say that they're now live. So on learning.foundation, you can access the responsive feedback e-learning course, and imminently we will also have the e-learning course available on the Curve website. So the really exciting part of today's session is going through the Curve process for responsive feedback. So I'm hoping that Dr. Mohammed Liman is able to present. So please, Dr. Liman, if you're there, let me know, because I can't see my screen. Zah, have you seen him join?
Lydia, I believe Mohammed Liman is not in the room.
Oh, okay.
Yes.
He did mention he was having trouble. Okay, no problem. So this section, I'll do my best to step in for Dr. Liman, but do please, yeah, allow for not as good of a presentation, because he is the expert. And we'll have Dr. Rachel McCloud take over and talk through the Curve process.
Sure. Thank you, Lydia. So as Lydia mentioned, when we have our courses that are live and a lot of our materials on the Curve website, one of the central things that guides us is this Curve process. And you can see it here on the screen now. So this is a 5-step process that can walk through those different components that I mentioned earlier, those kind of key elements of responsive feedback. And so what this process does is it kind of breaks these steps down into different modules or components and kind of gives the value of each, and then gives some easy to walk through kind of steps. And so you'll see we have convening stakeholders. So right from the beginning, making sure that you convene stakeholders and get those resources ready, uncovering those assumptions that you expect to guide your programs and probing those activities. From that, gathering those key learning questions of making sure that your assumptions really do match how your activity is going to lead to your outcomes. So these are kind of like research questions that really focus our activities for our responsive feedback approach. Then we lay out the roadmap to seeking the evidence and gathering from many different data sources, and finally evolving in context. And so I'll go through these steps a little bit more in detail, but Lydia, please feel free to introduce our case study now.
Wonderful, thank you. Wonderful. So let me know, can you still see that full screen?
Yes.
Wonderful. So yes, I guess to help you understand how these steps apply in practice, we will illustrate them through a case study of a project that used responsive feedback to improve project outcomes. So the project was implemented by the African Field Epidemiology Network, AFINET, who we've been working with for probably the past 2 years. And they've been working to try and improve the quality of administrative health data to enhance, oh, sorry, I'm not sure why there appears to be a timer on, sorry about that. So AFINET are trying to improve the quality of administrative health data to enhance primary healthcare programs. in several states. So the quality of Nigeria's administrative health data is very poor and has remained so for many years. This has led to persistent discordance in primary healthcare service indicators between the facility and survey data. So a lot of different technical introductions. Sorry about this. A lot of different technical interventions have been introduced with varied results. There has been little focus on the behavior of those generating, entering, and using the data. So this project intends to approach this problem with a behavioral lens using the FOG model, and it's aimed at incentivizing the states to improve data quality, specifically accuracy, completeness, and use. So using responsive feedback opens up opportunities for learning. You're getting a sneak peek. Responsive feedback opens up opportunities for learning that can inform future interventions in other areas. The approach provides stakeholders with a means to continuously collect data that informs the decisions that need to be made. It has advantages over traditional M&E that we used, and not just collecting data to answer the traditional evaluative indicators. Sorry about this. But it allows us to explore the context and nuances around the interventions. So this enables us to understand why they are not working and what needs to change.
Okay, so for the next couple of slides, I will kind of go a little bit more depth into each of the steps, and then I'll hand it over to Lydia to provide that in context with our case example. So at this first step, which is really important, you could hear in Lydia's introduction already the importance of stakeholders. And as I mentioned before, when we say convening stakeholders here, we're not just talking about the donors or the decision makers, but we want to involve people from decision makers, program implementers, any frontline staff, beneficiaries of the program too, those who you're hoping to serve, to kind of get that full picture of what's going on and kind of see the priorities and interest areas and feedback from the ground that some of them have. And within our course, we really emphasize this kind of stakeholder mapping, where you think about these different stakeholders, their interests and priorities, and what they could bring to responsive feedback. Because as you'll see throughout the curve process, this isn't just something that happens in the beginning. Stakeholder engagement is key throughout, and we want that buy-in and that integration throughout the curve process. And I think something else that's important in this step is, while we're mapping these stakeholders and kind of understanding their priorities and where they fit in this responsive feedback approach, we also encourage people to take a look at their own resources and organizational resources. Because one of the things I want to acknowledge is that responsive feedback isn't just for large organizations and sophisticated programs, but this can be for small programs that are operating in the field with not that many resources. And so throughout the course and throughout our teachings, what we try to encourage is that you take a look inward at your organization and see what internal resources that you have and what you can really benefit from. So even if you don't have the budget or the wiggle room to go and create a whole new survey or a whole new experiment, you can take a look at what you have and try to see what data you're already collecting, what process data you have, what might be easy to use to kind of integrate something in there. And so we'll get to that a little bit more at the Seek Evidence phase, but I think it's useful even from the very beginning to understand your program, who you have coming to the table, and what resources you have or have easy access to help really shape your responsive feedback approach. Over to you, Lydia.
Thanks, Rachel. Yeah, I think absolutely. I think it's vital to lay this foundation, and the AFNet project did this first important step by identifying those key stakeholders. So that was internally within the AFNet network, and it was externally with government officials at national, state, and LGA levels, as well as healthcare providers. They all fed into this process about designing the project, designing the responsive feedback mechanisms, and time and resource to it. It enabled quite a smooth process moving forward in the responsive feedback approach. And it ensured support and buy-in reducing barriers along the way.
Okay, now on to step 2, which is my personal favorite step, because as I mentioned in the first part of this program, I feel that this is one of the key values that responsive feedback brings. And whenever we have training courses and we're working with people on this step, I think this is where some of the true insights really occur. Because in this step, whether or not you have an official theory of change or that roadmap that lays out your activities and your outcomes, everyone knows the activities that they're going to perform within their program. And I think the assumption is that the activities that you have set in your program are going to lead nicely to these program outcomes. But unfortunately, we know that that is not always the case. And so this step is really about breaking down these activities. And the example that we like to give is for a training course. So in your program, you might have a training course that you're implementing, and that seems fairly straightforward. You have your materials and you know the time and the date and what you're going to say. But you really have to think about the series of steps and all the things that have to occur for that training to be successful. People have to be aware of the training. They have to be interested in it, be able to attend, especially if it's during work hours or if it's far away or something that requires transportation. When they get to the training, it's got to be something that they care about. They have to understand the material, and then through the very end, they have to be able to act upon that learning when they get back to their day-to-day life. And so that you can just see in one activity, we've broken it out to many steps. And this is kind of the thought process that we hope for people to get along, to think of what are these steps? What areas do I feel unsure about? And we really encourage that as people are thinking through this and kind of taking this closer look, that they think through the kind of organization or context that their program has and think about what are the barriers in the community to performing the action, what kind of media messages are there out there? Are there any laws or government regulations that might impact what I'm doing or the outcomes I hope to achieve? And a lot of the times you have a lot of this knowledge within your organization already, which again emphasizes that stakeholder engagement and bringing people from the community together and from your organization that could kind of help think through this and making sure that what looks great on paper is actually going to translate well to the field. And so this is, I think, a really valuable component and a crucial first step to think through those activities, whether or not you have an official theory of change or just kind of put them down on paper, walk through those steps and think, how is this going to work? Are there any challenges that I haven't thought of? Because this lays the groundwork for the next couple of steps of the curve process. So over to you, Lydia.
Yeah, I agree with you, Rachel. I think it's one of my favorite steps of the curve process. And I was actually lucky enough to do this step with AFANET in person a couple of years ago now. So as I mentioned at the beginning, AFANET's theory of change is based on a FOG model, so ability, motivation, and prompt. And I think it's my favorite because you have to think outside of the box, and we used an exercise called a day in the life, where we mapped out the day in the life of a rural healthcare worker. So as part of the program, how might they go about their day, as Rachel explained, and we kind of identifies those gaps in knowledge, and then prioritized the assumptions that we thought were most relevant and most impactful to the program. And yeah, I think it really helped us identify our gaps in knowledge and prioritize using sort of an impact mapping tool. Wonderful.
Great, thank you. So in this next step where we reveal our learning opportunities, this is very closely aligned to the step that we just talked about, because before we can ask specific questions, we kind of have to do that work to analyze our assumptions and to think through those areas that we need to know more, kind of in broader terms, because in this step, we're starting to funnel down and we're going to get more specific. Excuse me. And so we want to think through some specific questions, much like research questions, that can help us kind of learn more. And these are specific questions that'll guide us. And I think Dr. Liman might be here now. Dr. Liman?
Yeah, I believe Dr. Liman is in the room, but Dr. Liman, if you could click on the blue button, share audio and video to join the panel. Otherwise, you will stay as a attendee and Right. Okay. I see you're in the panel already. Great to have you.
Can you see? Great, great. Thank you very much. Had some challenge connecting, but it's good that I'm on board now. Thank you. So we are at step 3. Essentially, this step translates the assumptions and knowledge gaps that Lydia mentioned into learning questions. Its importance is in crafting good questions so we arrive at helpful answers. It enables us to gather the right data to shed light on the gaps in our understanding so we can make our decisions with better and more valid data and information, so that we can also revisit our theories of change and review to say whether they are still valid, especially the assumptions, and also to uncover uncertainties within our theories of change and try to redraw the line and see how we can improve our programs for the better. And one example of a key assumption that was identified by AFNet within the theory of change is using the prompts. The National Youth Service Corps members and identified what data ambassadors who visit the facilities to prompt health workers to remind them to record data accurately, and that will help improve the overall collection and collation or transmission of the data to the local government and upwards. So to test this assumption, AFNet put forward the learning question: are NYC members and what data ambassadors effective prompts for PFC workers to record data more accurately? And that was tested using the responsive feedback. Over to Rachel, please, for the next step.
Thank you, Dr. Liman. And so for our next step, this might seem a little more familiar to everyone, and this is seeking the evidence to start to answer those learning questions. And we've done a lot of work in the curve trying to think through the best way to talk about evidence that's best for responsive feedback. And, you know, depending on your program, there might be many different types of evidence that suit your needs. And these could often be used together. Some people use mixed methods, quantitative surveys, qualitative interviews. And so this is really about matching what types of evidence are going to fit best to your learning question to answer that learning question and help you move forward. But this is also a place where we want to emphasize, you can take a look at the resources that you have available, and want to emphasize that as you kind of plan your methods or strategies to gather this evidence, make sure that whatever you're doing is something that you have the resources to gather and analyze while you're still in the field. Because I know a lot of organizations have a problem with so much data that's coming in that there's just not time to analyze it all. And so one of the things that we want to do is help you prioritize the evidence that you're gathering and looking at, because it's really important that you have that time to do this in real time. And so when you think back to that first step of convening stakeholders and that resource mapping, and that first step, even before you start thinking of your learning questions, it's helpful to kind of have an idea of the resources you have at hand and your capabilities. That could be staff ability, staff time, other resources to other departments, or current surveys that you're collecting, to really kind of make a coordinated plan with some of this evidence. And so throughout our programs, we have many different examples of the types of evidence that people have gathered and how it can be synthesized to give you the answers that you need to make these decisions in the middle of the program. And so it's really up to you to work with your resources and see what kind of evidence you have the confidence in to kind of help you move forward and help you and your stakeholders make those decisions. Over to you, Dr. Liman.
So to understand whether the NYC members and what data ambassadors are adequate prompts from the perspective of the health workers, AFNet engaged community informants who visit the health facilities. They observe what the health workers are doing as far as the data recording and reporting is concerned. They sometimes identify errors and prompt them to correct those errors instantly. They also observe the way the data is being collected right from the patient at the health facility down to the registers and to the summary sheets. And they also informally interviews the workers to provide richer insights on how effective they found them. And then they transmit this information during the post and reflect sessions that happens during the data validation meetings on monthly basis. So essentially, the role of the community informants is to assess the effectiveness of the prompts. That's the National Youth Service Corps members and the World Data Ambassadors, essentially. And in that way, a lot of information is generated and insights that is discussed during the post and reflect sessions. Thank you.
Great, thank you. And I think I just heard pause and reflect sessions, and that leads us very nicely into our last step of the curve process, which is to evolve, and that's to make these decisions in context. But when we say in context, we also mean with that important group of stakeholders too, that we recognized at the beginning. And so what might happen is you might have worked with your stakeholders, kind of gotten these learning questions and gotten this evidence that can help to answer the learning questions. And then it might be useful to reconvene with these stakeholders in what we call a pause and reflect session, which is just that. It's a space carved out for you to work with stakeholders and present evidence or present questions and get feedback and come to decisions together. Because we know that while responsive feedback is designed to tackle a number of different issues, this could be small decisions like where to place flyers or exact wording in a brochure or how to set up a classroom. There are also big decisions that can be influenced by responsive feedback, and that could be, say that you see your whole structure of your program needs to be changed, or that something in your initial assumptions was very incorrect, or maybe the situation has changed. Maybe a global pandemic has interrupted your normal course of operations, and you have to change to adapt to that. So responsive feedback can help from anywhere from these little small decisions that might be able to be made within an in-team basis to these larger decisions that might need a whole organization or your donor involved. And so this is where the pause and reflect is a way for you to tell a story with your data in a way that is accessible to the members of your organization, to tell what you're looking for, where you found it, and work together to get to those solutions that often need that group process to get there. And so this is a very valuable step. And I'm really interested to talk about how AFNet did this step with their pause and reflect sessions. And just another thing to note is that when you get to this step, responsive feedback doesn't stop, because you've made changes to your program with new assumptions and new activities. And so as you evolve, you need to keep an eye on continuing this process. You're continuously iterating and thinking through the next steps. And so this is the jumping off point to changing and adapting and making things better, but continuing those checks to make sure that they continue to be better and you're still on the right track. So over to you, Dr. Liman.
Thank you, Rachel. So the use of National Youth Service Corps members and the World Data Ambassadors, we could see very clearly is that they form the foundational part of the theory of change for AFNet. So it's one area of intervention that will have significant impact on the overall outcome of the AFNet project. So they collected data based on the learning questions developed, and then came up with the key insights. And some of these insights will clearly be seen on the chart on the right side. Most of the healthcare workers say that they see the usefulness of the prompts as they come in constantly to remind them to record data accurately in a timely fashion. And also it helps them to recognize data errors instantly, and they correct these errors. And where they are missing data, they also try to identify where the sources of those data are, and they try to incorporate them into the register. Where there are calculation mistakes also within the registers, the prompts help them to quickly look at those instantly. So all these insights are discussed during the pause and reflect section that Rachel has just mentioned. So it gives them an opportunity to have an open and honest discussion without recourse to looking at who is responsible and who has, or what has gone wrong, or who is liable for what. So essentially, it's a free discussion involving all range of stakeholders, from the executives to the frontline workers to community representatives, and they discussed in a very open way those insights and identify action points that will help address some of the challenges that have been identified. For instance, where they see that certain facility is not quite coming in terms of getting the data accurately, they focus on those facilities and try to identify what are the actions that could be taken to help support those facilities. So this is how the insights are used, in addition to also sharing with other local governments and other facilities the findings, so that they cross-fertilize ideas and get more lessons that have been learned through the process. Over to you, Rachel.
Great, thank you so much. And I see we're starting to get a few questions in on this, so I'll just zip through this last section and then we can open up to question and answer and discussion. So the last component here is just a little bit more illustration on some of the challenges that responsive feedback can help overcome. So as I mentioned, and I just feel like this is such a key step here, is that responsive feedback can help identify and correct assumptions. And I don't have much time to go into this, and I know some of our course participants have heard a little bit more about this, but in our own lab, Dr. Vishwanath and I and our team had seen that there was so much information about COVID out there, and especially at the beginning of the pandemic, there was information and misinformation and just so many things floating around. We really wanted to find a way to distill some of that information for our community partners, as well as general audiences. We have community partners in both India and in Massachusetts. And so we worked with both of those groups and quickly put together a website dashboard that could answer frequently asked questions, that could address some myths, and took it from there. But I think over time, and because we implemented this responsive feedback approach, one of the things we quickly found out is even if you build a website with useful and helpful information, it doesn't necessarily mean that people will go to it. They have to know about it, they have to have the interest, they have to have the time. And so what started off as just a website evolved over time into more of a multi-pronged approach. You can see here that we started reaching out on different social media channels to different audiences. And I think one of the most important things we did, along with developing these visual aids, which were from direct feedback from our community, is we also started to really engage with these boundary spanners, or these influential individuals in the community that are some of our stakeholders that could then disseminate these messages to the population. So maybe we weren't having a website that would reach our end audiences and the communities directly, but we make these resources and these tools, particularly being responsive to the needs of our community boundary spanners and community leaders, so that they could then take what they needed and get it to their community in the way that best suited them, be that directing them to the website, printing out a flyer with an infographic on it. They would have these tools at their disposal. So this really helped us take our initial assumption of a website will work to that process where we adapted and kept building it to something that was more useful to our communities. So it really can help overcome those challenges. And we monitored our Google Analytics data and our social media engagement data throughout, so we could really kind of see the upticks and when people needed information and how some of these strategies helped us there. So that's just a brief introduction. We go into it a little bit more in our course. Next slide. And as I mentioned, responsive feedback can really help build in some of that agility in times of crisis. We have several examples now in our case studies of how this happened during COVID-19 and how people who had in-person programs had to restructure them and kind of rethink that. We also have, in one of our other training courses, we had found a wonderful example in Ebola, where there had been two programs. It was a tale of two programs. One was very rigid, and they weren't able to change their structure during Ebola, and they had to shutter their programs. These are classroom education programs. And another, which had stakeholder engagement, donor trust, and this kind of more agile approach, was able to completely shift and continue to provide services to students during the Ebola crisis. And so these are just some of many examples of people that have had to make quick pivots in these kind of emergency situations. And there could be other types of emergency situations, with people who are on the front lines of war or who are on any other crisis. And so responsive feedback builds in that agility and to kind of be able to switch gears when needed and assume that that could be a possibility. So even from the start, maybe you start to think of what could happen to this program, what do I need to be prepared for? So it's really good in those types of challenges to just kind of help adapt as things arise, especially if you have that stakeholder engagement and can kind of bring that group together to make these decisions. Next slide. And as we've mentioned before, I think that taking this responsive feedback process, this curve process, really thinking at the beginning of what resources do I have, what do I need, what can I accomplish, can really help you uncover these data sources and evidence sources that can be useful. And this can range from gathering people together and getting their feedback. It can say, hey, we're already talking to a lot of people in the community. Maybe if we also ask them this question. Or on the middle graph there was radio calls. And so this was people that were call-ins to a radio show about family planning. And so they decided to take what the calls are already occurring, make sure that they tracked the types of calls, the number of calls, who was calling in. And then they also were able to pull from that different insights on the barriers that people were facing for family planning and what a lot of the calls were for. And in this particular instance, they realized that they needed to go back to basics because people were calling into this radio show with just basic questions about family planning. And so they could adjust their strategy just based on taking closer note of calls that were just already a natural part of the show. And then on the other side is the social media data, which I was talking about with our dashboard. Google Analytics is already collecting this data for us. And so going in, and so are social media sites. So just going in there can give you a key, and you can see we have a bump when there was a COVID outbreak in India that coincides with that bump you see on the screen. And so we could tell this is a time where people are really coming for more information. And so these are already things that were kind of built in that we were able to access and use as those ready sources of feedback. And other programs have been more structured and built in test cycles and things like that. But it can be using the resources that you have, and it can be a way to think smarter. Because at the end of the day, we want responsive feedback to feel intuitive, to be a part of your program that you can integrate and work with what you have to really help improve those insights and those outcomes. Okay, next slide. And my final point here that I would just like to emphasize is that, in the beginning slide, we talked about how assumptions are set, the program runs, and then you're kind of unable to do anything until the end. But in a responsive feedback approach, you can integrate this at any time. It's not like if you haven't put in responsive feedback from the very, very beginning of your program, then you're not able to use it. Responsive feedback can be useful at any stage of the research process. Even if you're in the middle of your actual rollout, you can still take a look. You're probably collecting process data. You can see what's going on and what might need to change. You are in those beginning stages. Maybe you build in a couple of small experiments or tests to see which strategy will work best if you have time in your formative research or pilot phase, and seeing what agility you can have. Although this might change as your project moves forward, there are still opportunities to design, prototype, and test, to continue to adapt. And even at your inline, if you're going to scale up, you can use so and look at this information and see how it informs those next steps. And then throughout, as you see on the bottom, having these pause and reflect sessions throughout, engaging with those stakeholders, having a better understanding of the context of which your program is operating from the very beginning, and having those open lines of communication make responsive feedback a valuable approach at any point in the program lifecycle, and something that can be of benefit. Okay, and so I think, Lydia, I'll turn back over to you and we can start some discussion.
Thank you, Rachel and Lydia and Dr. Liman. I actually see that there are many members of the IA 2030 movement who have just joined the room, or who joined the room a little while ago, and some of whom are actually in the panel. For example, Dr. Kaushik Nag, Pham Daniel, Prince Michel, and others in the room. So I would like to turn to them. So they have actually, as I believe, completed the online module on responsive feedback. And as a form of support for their field implementation to implement their IA 2030 action plan. So they're using responsive feedback as an approach to improve immunization outcomes. So I want to turn perhaps to Dr. Nag, Farm Daniel, or Prince. Do you have any questions now that you know a little? You already did the module and you already just learned a bit more from Rachel, Lydia, and Dr. Liman. So just to want to flag that to Lydia as the moderator to give room to the IA 2030 movement members.
Hi. Good evening.
Hello. Thank you. Please go ahead if you do
hello.
have questions.
Yeah, I am Dr. Kaushik Nag, working as a faculty community medicine Tripura Medical College, India. And it was a very great learning opportunity of this responsive feedback. I liked the way how it teaches step by step how to first identify stakeholders, then to find out the resources, then challenges. I like the approach. It was new for me and all the faculties who are there, like Rachel ma'am and others. But Vishnu sir was not there, I think, due to some reason. It was nice, and my challenge was AFI, fear of AFI among general people, and to raise awareness. I wanted to do some health education in the community, and for that I needed to train. I need to train my interns because there is a center, rural health training center attached to our medical college, and interns are posted there. So that's why within 10th June, I think, I did a training program on AFI and also the steps, and also I have shown them the reporting, how to report AFI report. Also, I took help of one pharmacovigilance officer who do this reporting part in Indian Pharmacopoeia Commission, and he also taught how to record, how to report AFI form. So subsequently, I am planning to do health education session and also other awareness activities if it is feasible. And it was a very good learning opportunity, and I want to thank all the team members of this responsibility. That's all from me. Thank you and take care.
Thank you so much. Rachel, did you want to say anything in response?
Well, I just want to say I remember you from the training and all of your good insights, and I'm glad that you were able to learn from the course and share with us today.
Absolutely.
You also.
Thank you. Do we have any other questions from the panel?
And Lydia, I also, I think Vish has joined and he's watching on. So if we have any questions or comments that we would like from Vish, we can save a minute or two for that as well.
Yeah, absolutely. I was trying to figure out how to invite him. Zah, would you be able to help include?
Yeah, I see Vish is in the room. Vish, if you would like to join the panel, you need to click on the blue button, share audio, ask to share audio and video. I see he's just done that.
Oh, yes.
Great. Professor Vishwana, good to have you. And I do see that there are one question from Mary Adomako in the chat, who asked, Rachel, can you please elaborate on the midline phase? Thank you, Mary. So Mary, I would encourage you to be a bit more specific. Do you mean the developing and prioritizing learning question that you would like more clarification on? If you wish to get more clarification, I encourage you to join the panel as well, or type a more specific question in the chat. And I see there's Chika 4 and others who just joined the panel. Any questions that you have on responsive feedback, now it's a great opportunity to ask with both Professor Vish and Rachel and the other members of the CURV team in the room. Chica, I believe you're muted. We cannot hear you. We cannot hear you, unfortunately. Perhaps try refreshing your browser and rejoin the panel. In the meantime, I do see there are two questions in the Q&A section from Joyce Muruti, who asked, I think the first question is actually about the online learning module. She asked, is the technical training free? Who are eligible? How do you tie the responsive feedback with Immunization Agenda 2030 and building COVID-19 vaccine confidence? Perhaps I can answer the first part and then turn to Lydia or Rachel for the latter part of the question. The module is free. I will share a link in the chat later on, and you can see, Joyce, who the participants are encouraged to join. And then the other question from Joyce in the Q&A section, who are the member countries of AFNet? Lydia, Rachel, or Dr. Liman?
I don't know off the top of my head in total, because I do know they're Pan-African. So I think their headquarters are in Uganda, and then we've worked with AFNet Nigeria for the last 3 years. But I do believe there is more, and I'll research that in the background and get back to you, Joyce. Chica, I'm sorry, I don't think we can still hear you.
Chica, I think maybe you, if you go to the browser link, there's a little lock. You need to make sure that you have given audio permission for hop in. So if you could double check that, would be great. And we all have issues like this with technology. If in the worst case scenario, Chica, you're not able to rejoin and ask your questions in person, type your question in the chat and the Curve team will do their best to answer it.
Before the end of the session, I would like to invite Professor Vish Viswanath to say a few words. Thanks so much for joining, Vish.
Thank you. I don't need to interrupt. There are a lot of questions coming up. You guys are doing a great job, and I really love the participation and engagement of the audience. There are some great questions. So I think we should encourage them to ask those questions and answer them. Mary had a question on midline research, which is also called process research. Maybe we can clarify that. And I'll be happy to answer any questions that come up. But this is great. I'm grateful for the participation and engagement of the audience today.
Thanks, Vish. And yeah, I think in the chat, I did respond to Mary that, as Vish said, this is often when projects are live in the field and you're looking at that process data, and you can adapt programs, as they're in that kind of implementation phase.
There's a new question coming in. Mary, who just asked, what do you think if a community does not take the initiative in health? For example, if there is not a vaccination post for the month in the area, no child has come to the health center to receive their dose. Comments, feedback? Rachel, Professor Vish.
Yeah, I can certainly answer that. So there is, community doesn't have to take the initiative, because I think we come with an assumption, number one, that community members are extremely busy. They have a lot of other things going on in their lives, what we call as daily hassles. It could be because of any number of reasons, whether it is awareness or lack of awareness, whether it is lack of access, whether it is lack of urgency, a feeling that it is not necessary. So the first thing to do, to go back to the curve process, as we said, figure out, convene the stakeholders, in the critical stakeholders in the community, and find out what is it that is precluding them from taking that initiative, what are the challenges they are facing. I think what it calls for is a listening session, a deep listening session from the critical stakeholders and the influentials in the community. Following that, you can develop your assumptions about what kind of program you can do. I hope that responds to your question.
Yeah, Mary, Claudine, feel free to type in the chat if that answer from Vish is satisfactory to you. And I see Joyce has just joined the panel as well. Hello, Joyce. Can you introduce yourself? And what questions do you have for Professor Vish and Rachel and Lydia, Dr. Liman, regarding responsive feedback?
Thank you very much for this opportunity. I'm Joyce Moredi. I'm joining you from Maryland, USA. Sorry, I had stepped out for a little bit. I am a DARE advocate for Immunization Agenda 2030, and I have been joining some of you or watching the webinar on responsive feedback. I have about 3 short questions. And one of them is the technical training that you spoke about previously. Is that free? And who are the people eligible to join the technical training? And then my concern is, how do you tie the responsive feedback with the Immunization Agenda 2030 and building of the COVID-19 vaccine confidence? Thank you very much. And I really appreciate this session. It's very informative.
Thank you, Joyce. I'll just quickly jump in on the first question. Yes, the training is free. So it's available currently on learning.foundation. And then it will also shortly, hopefully next week, be available on the Curve website. So we'll make sure to circulate. Oh, perfect. Thank you. I think Zaz just put it in the chat for you, a direct link to the online training. And then I'll pass over to Vish or Rachel for the second part of the question.
Go ahead, Vish.
Sure. I'll give a very short answer, and Joyce, I'm very happy to respond in more detail offline because I have another call with another country shortly. The point, I think, is to figure out what is inhibiting the vaccine confidence in COVID-19 vaccines. I think we have the luxury of a large number of studies that have been already done in many parts of the world, which show why confidence in vaccines, especially COVID-19 vaccine, is lacking. And I think and how it is affecting general immunization agenda, vaccines in general. There are a variety of reasons. One part of it is misinformation and disinformation, but other parts of it is lack of access to vaccines, where people do want to get vaccinated, but there is just no access. And only today I just read that the vaccination access is improving, but it is insufficient. And so it is at the personal level, the lack of urgency, as I said, the notion of it is not affecting me, it doesn't affect me, or it is not serious, what we call a susceptibility and severity, or it is the norms in the community. Is it acceptable in the community to get vaccinated or not, or do your fellow community members think it's a bad idea to get vaccinated? That is important to address. And then issues of access that need to be addressed. So all these things matter. And my concern recently has been that these things that have been affecting COVID-19 vaccination are also affecting general vaccine confidence, which we have built very successfully over the last 30, 40 years, a very successful immunization. So it's very critical to address both the immediate COVID-19 vaccination issues towards that 2030 agenda. That's a very brief response. My apologies for the lack of time, but hopefully we can pick it up later. Thank you so much.
Thank you. Thank you very much for that response. I appreciate that. As Dr. Vish was speaking, if you allow, I was just wondering, what are some of the things that one would look into as far as responsive feedback is concerned when you think of vaccine access or vaccine delivery? Thank you.
I believe that Vish had to jump off the call. So I would say, as far as vaccine access and delivery, if you're going to look from a responsive feedback approach, you know, that environmental assessment of where you're talking about, like what are the conditions and in the communities in which you're trying to get vaccine access, you know, what are some of the ways in which these communities might be able to, you know, give vaccines out, like what is the setup of the community as far as clinics are concerned. You know, do they have weekly, if you're talking about delivery as far as to, you know, individuals, I think, you know, what is the usual way in which people receive care in that area? What are the usual strategies? I think your main bet is going to be working with the health clinics in those areas and any sort of community partners that work in vaccines, and really talking to them and understanding, as we mentioned before, a day in the life of what is it, you know, if you're trying to increase vaccine delivery within these clinics, you know, ask the people who are doing the health services, like, what does your day look like? If we asked you to do X with vaccines, how would that fit into your workday? You know, and I think that a lot of times in healthcare, especially with COVID, people are so overburdened and overworked. You know, you want to make sure that any strategies that you have would fit in with their usual day, and that wouldn't be adding so much that then they get overwhelmed and things would fall apart. You know, you want to work with them to find those strategies. And, you know, if it comes to making sure that doses are stocked, I know that in our course, we had people that were working on trying to make sure that everything was logged correctly so that they wouldn't have those staffing issues. And there was someone that was looking directly in for their responsive feedback approach as to how to best write things down and make sure that everything is recorded, so you know how much you have in stock, what you need, and giving people training on just making sure that that end of the process was okay. And so, you know, there could be several challenges from that proper documentation to making sure that it fits within the workday of the clinics, to making sure that the populations are interested in going to come. And so I think that there are several different issues as far as getting vaccines from where they need to be in the clinic and out to people. And then I think that's a good point to think of all the different assumptions at each of those different steps and break it down into what could go wrong. Where do we really need to focus? Is the problem getting vaccine shipments to the clinics? Is it that people are too hesitant to come in to take them and they're going bad? You know, it's looking deeply into that process and then breaking it down from there as to, okay, we have this activity, this is our key point. How do we break that down in those individual steps and really think what could go wrong, and just trying to getting as detailed as possible as we tried to do in our sessions, and really focusing on that environment, no matter where you land on any of the things that I just said, as far as resources within the community, beliefs or values. At the health clinic level, are they incentivized for working? Do they feel like they're part of the process? Do the healthcare workers feel like they have buy-in to this whole process and that their feedback is being heard? You know, there's just so many different points, but drilling it down and trying to understand those underlying factors that could help or hurt your cause, I think, is going to be useful.
Okay, thank you very much, Joyce, for your questions. I hope Rachel's answer was satisfactory, and I want to thank Rachel, Lydia, Dr. Liman, and everyone, all the scholars, the IA 2030 movement members who joined this session on responsive feedback. As Lydia was saying, this online module will be officially launched. If you have done the module, you think responsive feedback has been helpful in your field implementation of your IA 2030 action plan, invite your colleagues who haven't had the chance to learn, or maybe who will be curious